So before we start with anything, I would like to know your name as well as where are you practicing at and how many years you've been doing this.
I'm Dr. Ashish Chhajed. I practice at Dhule and I've been practicing since 10 years now in urology. And ours is a urology dedicated center in which we have the most advanced laser, which is the thulium fiber laser, and which is one of the most latest laser which we are having. And we do all types of modern treatment of kidney stones, laparoscopy, urethral reconstruction, pediatric urology, and all other cases of urological illnesses.
Okay, so today we're going to be talking about kidney stone management. So first question over to you. Why do you think the number of cases for kidney stone are on the rise?
Well, India is a very hot climate. I think the only climate in India is hot and less hot. So that's the most important part. There is a lot of dehydration. Then the dehydration will leads to concentrated urine, and once the urine gets concentrated, the solutes also get concentrated. So this concentrated solutes will eventually crystallize and form a stone. Then it begins with a small crystal. Over it, no number of crystals. They just keep on adding, and eventually the stone becomes big. Now the stones later on dislodges from the kidney into the ureter, into the pipe, and they cause various symptoms of stones. So this is the primary reason. Other than that, there are also many dietary reasons. Very unhealthy diets is followed, water intake is less, fresh fruits are less, junk food is more, salt intake is more. They are also contributing to number of increase in the number of stone cases.
Okay, in your experience, what precaution can effectively be taken by the patient to avoid having kidney stone, and or if they have had it, what can they do for not getting recurrent stone?
Okay, so the most important precaution which anybody has to take is to drink lot of water. The amount of water intake is the most important thing. Any other things can be managed, but if you do good amount of precautions but you don't drink amount of water, that is all going to get waste. So drink lot of water, have lot of fresh fruits, citrus fruits, orange, lime, lemon, then cranberry juices. And to avoid things, I think you should avoid non-vegetarian food because it is rich in oxalates. Then you can avoid, if possible, chocolates, which are again oxalate-rich food. Then dark tea, dark black coffee. They're also quite contributing to kidney stones formation.
Okay, what do you think is the greatest misconception that people have about kidney stone?
Yeah, the greatest one and the most funniest one is drinking beer will get you out of stones. So that is not actually that. Beer is just a cold water which anybody consumes in big quantity. So what that big quantity will itself cause diuresis in the kidneys, and they will cause anything to flush out. But if you continue having the same thing again and again, then the content of beer is very rich in oxalates. So oxalate is the biggest causative factor for stones. So long-term consumption will eventually cause stones. So if you want to, if at all you have to get the benefit, you can get the same benefit by drinking the same amount of any cold liquid or water.
Okay, heading towards the next one. What do you think is going to be the next breakthrough in kidney stone domain?
Well, I think the treatments are already changed. Like the next breakthrough, we are already living with it. We have the best laser. Thulium fiber laser is the next breakthrough, which is already there in the market, and it just melts the stone. So all the treatment has changed. The thing which was in the past, like you have to do hole in the kidney and take the stones out, most of the thing is out now. We do everything endoscopically. The patient gets discharged in second day. Most of the kidney stones don't even realize patients ki how easily the stone was getting operated. So that is what is the next trend, and it is going to continue. Newer lasers will come up, and new medicines will also come which will prevent the growth, and eventually that is a very good future for stones patient.
Okay, lastly, what are your go-to kidney stone management solution to the patient?
Most important is the diet, then medicines. There are only 2 to 3 medicines which are effective in passing the stones, and there is a very limited size up to which the stones pass. So whenever possible, you consult your urologist nearby, and he will guide you properly when to take medicines, when to go for operative. Everything is quite well studied and well documented, and once you go by that plan, eventually you will be very easily managed with the stones.
Well, that's all. Thank you very much for your time. Have a great day ahead.